How did the lockdowns affect our lives?
I see masked people. On Halloween? Medical face masks? You mean like at the dentist or the hospital, the doctor's office? Walking and driving with no other people. They think it stops the spread of viruses. And they scream at you if you don't wear one. They don't know about Event 201.
How often do you see them?
All the time. They're everywhere.
How did the lockdown affect our lives? The global COVID-19 pandemic unexpectedly entered our lives and put everything to a halt. It affected the lives of people around the world, bringing a flood of tension and worries followed by negative thoughts and piles of boredom. It's likely that these unprecedented times shaped people's personality traits to a certain degree as people were forced to leave their comfort zone and their daily routine. The many months of changes to our routines may have led to changes in our behavior that will stick long after the pandemic has finished. It may lead to new norms which may over time also shape our personalities. Since shutdowns are intended only to slow the rate that people catch the disease, not to stop it altogether, with few exceptions, the shutdowns are not going to reduce total lives lost. The shutdowns will only prolong the agony, while endangering countries as a whole with economic destruction. As economist Walter Williams said, decisions should be based on cost-benefit analysis. For instance, if the country reduced the road speeds to 5 miles per hour, we could likely stop 40,000 traffic deaths each year. But we don't do this because of the consequences. If governments keep the shutdowns going, the economies worldwide will be devastated, and it may take many years to get going, causing untold hardship and suffering for millions of people. It's also unclear how the isolation and physical distancing may influence the development of socio-emotional skills, like regulating your feelings, exercising self-control, and managing conflicts with your peers. It's now known that time in education is essential for helping children to mature, particularly if their parents aren't modeling those skills at home, and the time out may delay their progress. In general, children with more siblings appear to develop social skills at a quicker rate, so it may be that it's the only children who are the worst affected. We don't have any truly similar experience that we can look into the past to try to see what happened. But kids are sensitive and responsive to their environments, and stressors early in life have consequences for child development, mental health, and human capital development, so people are quite concerned. Since the poorest will be hardest hit by all of these effects, lockdowns are expected to widen the existing inequalities across the globe, with repercussions for years to come. It's disadvantaged children who pay the greatest price here, as they will fall the furthest behind and have the fewest resources available to catch up once the pandemic threat has passed says Armitage. Moreover, the longer the virus circulates in the population, the greater the chance that it will mutate dangerously, causing us to have to do this all over again. When today's children and adolescents grow up, will they see themselves as a lost generation whose lives will forever fall in the shadow of a global pandemic? Finally, a large number of studies on the multiple negative impacts of public health measures implemented during the COVID-19 pandemic on children and families have been published. The magnitude and number of negative impacts appears to be increasing. The stay-at-home orders and school closures enacted in response to COVID-19 are unprecedented in their breadth and duration, and this presents a risk to children and families for various physical and mental health problems. Intersectoral collaboration involving public health, primary and acute care health services, community partners, and education will be needed to develop evidence-informed programs, particularly on mental health promotion to support families and their communities as the pandemic continues and likely into the years ahead.
Lastly, coronavirus has taken our freedom.